Senator Grassley is next.
Well, can you skip me?
Of course.
There's no way to skip to, right?
No, we got plenty of people.
And then get me on the next.
What we'll do, because Senator Grassley has strong views on these issues, we will have Senator Tillis now and then Senator Stabenow. And if other colleagues are on the way, let's get Senator Tillis and Senator Stabenow and Senator Grassley in, and then I hope other colleagues will come. Senator Tillis.
Thank you, Mr. Chair. Thank you all for being here. I'm glad that Senator Cornyn brought up the Safer Communities Act. People call it a gun safety bill. I call it a mental health and safer communities bill because it is an extraordinary investment. And proud that North Carolina is one of the first 10 states to receive the tranche of funding to expand behavioral health access, particularly in rural communities, but across the board. Ms. Myrick, back in 2007, I was diagnosed with an illness that required me to take medications that caused me to have pharmacologically induced mania, followed by clinical depression. So I got a window into mental health that I consider to be a blessing. Had I not had a wife, when I'm in mania, I felt like I could fix any problem anyway. I simply would not have sought a healthcare or a behavioral health professional. And when I was in depression, if I went to a website, went through what you did, I'd have said, what's the use? So we need to understand this has real life consequences, and you're in the worst possible state to have the complexity and maybe even have it in the middle of depression, finding out that you have to pay out network costs. So now you've got financial stressors, you've got whatever the underlying condition is. The insurers, the providers, everybody need to understand that. I want to get to getting regulations right. I think if we're punitive, then the resources to the healthcare, to the insurers is going to come from somewhere. And most likely it's going to come from the pockets of patients at the end of the day, or from providers by lower provider rates. So we have to get this right, but we have to do something. And I'm sorry, how do you pronounce your last name?
It's right up.
No, I'm sorry, I got yours.
Giliberti.
Giliberti, okay. What would be wrong with HHS and CMS? I work for a Big Four audit and management consulting firm for most of my professional career. And for one thing, it's shocking to me that the insurers wouldn't have this as part of their annual audit regimen, that they already don't have within their all of them have internal audits. They have the scale, they have to have it, and compliance. It's shocking to me that they don't have an audit program of record where they're going through their provider networks. So rather than mandating that, why couldn't we move towards mandating to CMS and giving CMS the technology, the resources necessary to do it, that we're going to perform audits. We're going to determine, I think in one example of Medicare provider information, that they're about 50% accurate. What would be wrong with an audit or a review by CMS giving them an F because they have a failing grade and having published that on the website? A part of the carrot, and I think a competitive advantage for the insurers would be go to the CMS website, see our rating. We've got an A, B, C grade, 1-star, 2-star, but why not a kind of an incentive for them to just make this a part of standard operating procedure, auditing it, and then getting the underlying information systems that they have in place to get a higher grade. Rather than, because if we come down with a heavy hammer, they're going to comply, but that's also taking their attention away from finding additional providers, driving down cost of insurance, and a number of other things. What would be wrong with a light regulatory regimen as a way to start that I think that generally would get bipartisan support?
Well, I think that is absolutely an important component, so it would be a great advance forward.
Yep.
Obviously we'd like the whole piece, but I think that having that would be very, very helpful. CMS has done some auditing, but they didn't identify the plans, which I think is what you're saying,
Yeah.
Senator.
Well, and I think if you do that, you're going to find the audit and a test ecosystem very quickly come up with advisory services that are going to go after these companies and figure out how they can accelerate it, get data integrity right, get out of the over-promising and under-delivering that we have today. And I also think you said something that's very important. If you have somebody select a plan, maybe because they looked and saw a very large provider network, and that proves not to be the case, and they have to go out of network, I think that's a legitimate case where the person who sold you the expectation that you had these options, and when you came into crisis, you have those, that should be the insurer's problem, not the insured, the insurer's problem. But to me, those are relatively modest changes that, if they're implemented properly, I think could have a significant behavioral impact that benefits the insurer. And I have no more time left, but on the workforce thing, if we want to get this right, it can't be just about educating more doctors, because we simply won't get the pipeline. I spend a lot of time, I've got a couple of schools you may have heard of, Duke, Chapel Hill, they train a lot of doctors. They tell me that the outlook is bleak. So if we knock the cover off the ball, we're still not going to have enough, and we're not going to knock the cover off the ball of getting people into this profession if we don't deal with a number of other underlying reasons why people are leaving earlier and not getting into the profession.
Thank you, Senator
So
Tillis.
those are things we have to talk about if we're seriously going to get it done. Thank you, Mr.
We're
Chair.
going to work with you, Senator Grassley.